So today we're with Jen Allred, and she's going to share with us a little bit about her experience in natural childbirth. So Jen, just take us back to the beginning when you first found out you were pregnant.
When I first found out I was pregnant, I just decided that I wanted to do it all natural. I wanted it to be unmedicated, just for my health and the baby's health, and that's what we decided to do. And then I just started doing a lot of research on ways to deal with the labor, to help with the pain, as well as all of the stuff for afterwards with the baby, like for the baby's health as well.
Awesome. So you did a lot of things to research the process of being pregnant.
Yeah.
And I'm sure how to it didn't seem like, I know you worked up to the day, almost to the day you delivered. Didn't seem like you had a lot of symptoms with nausea or tiredness or anything like that.
From the start, the first trimester I did have some. I talked with the doctors and they told me, eat more protein. So I started eating a lot of almonds. That was my snack rather than saltine crackers. A lot of people think they should eat saltine crackers, but the doctors told me it was protein that I needed. So started doing that and it helped a lot. So.
Good. Yeah, Dr. Sherry is a wizard at this. Yes. And then also, during, you said your experience in the labor room, well, actually, let's step before that. You did a birthing plan, right?
Yes. Yep. I researched everything that should be in your birth plan, and I typed it all out. I took it to one of my doctor's appointments, and she went through everything with me. We discussed it, and she agreed to all of it, so and we went from there.
Awesome. And when you were actually giving birth in labor, everything went as you planned? And
yes. Yep. They all had a copy of it. All the nurses did. They all read it before doing anything with me. I also had my mom and my sister in there, and they read it as well, so they knew, and my husband, so they all knew what I wanted. So they all made sure that it was followed. Yep, it all was followed. Everything was.
Awesome. And you had no pressure or anything?
Nope, they didn't pressure me about anything. Like one of the things on my thing was no epidural, don't even ask me about it. And they didn't ask me once.
That's awesome.
So, yep.
That's awesome. So how much of that do you think, obviously you did a lot of research and studied up on what you wanted and the different options, but how much of it do you think was your communication with your medical doctor and the person who's going to deliver?
I think it was a lot. A lot of doctors, they don't agree with a lot of what was on my birth plan. And so talking with her beforehand, she told me, I don't normally do this, and then she would explain it, and she finally agreed to a lot of it. Like Pitocin, I told her, did not want it, don't even induce me. She kind of tried to push me for that towards the beginning, but then I think she realized that I wasn't going to budge, and so she gave up on that.
Awesome. Yep. Awesome. And you're obviously a tiny person.
Yes.
And you gave birth to a healthy, how big was
she was
Zoe?
7 pounds, 10 ounces.
Awesome.
So she was a good-sized baby.
Awesome. Well, that's tremendous. And we look forward to sharing more of Jen's experience with you in terms of that process and breaking down, chunking down what her resources were, how she came about with her birthing plan, and just how we can help more people experience a natural childbirth.